right off receive the PPE to be out in the communities to start testing. We also knew that we didn't want to close doors and let any of our medical workforce go. So we developed a plan to utilize every person within our health center to make sure that we were educating, communicating, and supporting our existing patient base, and also providing services to those that were not our current patients. We did that by developing an enabling team. We were all constantly reporting data, reporting resources, trying to maximize who can we partner with, who has the largest influence, how do we get people to the resources. And then as we got closer to the vaccination, it was how do we get the resources to the people? Because people are in fear of coming out because we experience so much loss, so much death across the world. So we've had to actually physically go into neighborhoods, physically go where people shop, and they are coming out and try to provide those resources. Relationships matter, because if you don't have those connections, someone that you work with every day or every month in the community may have them. Even to organizations like larger corporations in more metropolitan areas that want to designate funds and giving resources to smaller communities has been very important. I would also say making sure your staff, they're upskilled. They're not only able to do the position that they're currently hired to do, but you continuously train them. You continue the education and training around in the event of something like this happening again. So building sustainable workforce members, also a platform in which you can communicate broadly out to people has been important. Understanding the resource capacity in a community. So high risk areas, high volume areas where you need to get communication, education, and resources out is very important, because it's one thing to speculate, but to actually do the research, to actually be out in the community to know has been very important and helpful for us.